Welcome to Living a Full Life podcast. Join us as we explore health topics that encourage raising healthy children, living a healthy life, and living the best life possible. Now, here's your host.
Hi, everyone. Welcome to another episode. I will be your host today. My name is Dr. Enrico Dolcecore, and I thought a great topic this week would be talking about nerve pain or pain in general, or you can even say pain, nerve pain versus muscle pain, but just to talk about pain. And this was spurred by a testimonial I just had last week, and we get testimonials every week, but this one was unique. Facial pain. It's actually called trigeminal neuralgia. It's pain that radiates usually on one side of the face. It can even cause like a palsy in the face. But in this case, this woman was younger, her early 30s, dealing with it for 4 to 5 years and been through everything. Scans, MRIs, medications, literally tried everything. And came across on a social media group, and someone said, you know what, go try upper cervical chiropractic, specifically chiropractic, and then upper cervical chiropractic. And long story short, she found us, did an assessment, misalignment of the upper neck, but her symptoms were pain, and she was having this pain and trying to tell me with holding tears back, and didn't believe me because she's talked to everyone. So I said, listen, this is our theory, is that if there's a misalignment, it could be pinching a nerve stemming from the spine, and this could relay pain to wherever that nerve goes. And long story short, we assess it. She has the misalignment. I give no promises. I say, listen, you have it. You have this misalignment. I've seen it before. I've helped many people with trigeminal neuralgia. And you can kind of see her, trying to hold back the tears and hope. There's a glimmer of hope. So we gave her first adjustment. She came back. She's, 2 days later, and she's like, I don't know. I feel like maybe the intensity's down, but it was after that second adjustment that she reduced in 50%. Long story, 4 treatments. It's all gone. It's been weeks now. No pain. So she comes back and, quick talks because she doesn't want to cry. And I don't want to cry either. So we were like, great, high five, see you later. But it was about the pain and how long people deal with pain and truly understanding pain. So pain is an alarm system in the body. It is a good thing. If you've ever been in pain, you think I'm crazy saying that because it sucks. But it's the alarm system in the body. Imagine you having a fire alarm in your home and it just goes off. There's a reason for it. You do have alarms in your house. They're called smoke detectors. If those things go off, you don't ignore them. Please don't ignore them. It could be as simple as the battery is weakening and it's time to change them. That's probably the most common reason they go off. Or there is smoke somewhere. Right? That's what the body has as well. They are solar powered in the body, so you don't have to worry about batteries. So if they go off, there's smoke somewhere. And that's what we need to look at for pain. What's the body trying to tell us? Sometimes pain is blunt. You get hit with a hockey stick on the shin. Okay, shin hurts. You understand why. You're probably not going to rush to the ER. You're going to probably let that heal. But in other cases, pain can be excruciating. Low back pain, facial pain. These are probably the worst. Back pain is probably the worst. It's probably the number one reason why people go to emergency care or urgent care is because the back pain is relentless and it's a 9 out of 10. So they run there but they don't get a diagnosis. So they may get a scan. They may not get a scan. They may get an x-ray. They may not get an x-ray, but they're usually released and said, hey, it's a muscle spasm. Here's some stuff. See you later. And by understanding what it is, we can take care of it in a more efficient way. And pain is the number one reason we utilize medicines. It's the number one reason why you go under surgery. It's the number one reason. It's because of pain and discomfort. So understanding pain. What is nerve pain? Nerve pain, if it truly is a nerve, it's going to refer, which I say it's complicated because nerves travel throughout the body. So a nerve is your electrical system in your home. Just because all the power is sourced at your fuse box in your garage or wherever it may be in your basement doesn't mean that that's where all the problems are going to be. So wherever those nerves and those wires go, that's where the symptoms could travel to. So pinching a nerve can refer. So if any of you have ever had leg pain, foot pain, or anything related to sciatica, it can go anywhere down that leg. It could be the whole leg. It could be just the foot. It could be just in the low back. Sciatica is brutal. But understanding what it is better in the diagnosis process. So nerve pain is typically sharp, tingling, stabbing. That's that pain where you feel like you're being stabbed. Muscle pain is usually localized and dull and achy. It's dull, achy, tight. You can feel the tightness. It can be sharp. A muscle spasm can be super sharp, but a muscle spasm is neuritis. It's the nerve that's irritated to the muscle, and it's causing the muscle to spasm. So usually we don't have a muscle issue. A muscle cramp is where a muscle tightens and it won't release the way it's normal. It won't contract the way it's supposed to. That is typically hydration and electrolyte balance that's causing muscles to cramp. It's because you either sweat a little bit more in the last day or two, you didn't drink enough water, or you stayed in a weird position. You sat crisscross on the floor for too long, and then your foot cramps up or your low back cramps up. So those are the types of pains. But ligament pain too. When we sprain our low back, the most common back pains that we see in the office is nerve pain from some type of nerve pinch or nerve interference. Number two is ligament pain. People mostly sprain their backs working in the garden, and they come into the office, and then the next day they can't bend to touch their toes. Like, oh my gosh, it hurts. Does it? And I ask, does it radiate? They say, no, it's right here. And they point somewhere above their belt on their back. And I'm like, yeah, that's you probably strained or sprained your low back. It's usually a sprain. So some motion and chiropractic adjustment or physical therapy really helps with strains. Same thing with sprains as well. And the ligaments and strains and muscles is by getting them to move or getting them massaged or getting them, manually released, manual release therapy or myofascial release therapy. Those are the best for muscles. Laser anti-inflammation, they usually swell up. They're warm. You can tell. Nerves don't do that. Nerves don't swell and they don't get hot. So when you have a pinched nerve or something, it's very rare to have a pinched nerve. And that's the most common thing people say is, I think I have a pinched nerve, and they're mostly wrong. It's not. So just trying to understand pain. But talking about these nerves and where they go in the body and why these smoke detectors go out is a good way to understand how pain works and what we can do to mitigate pain efficiently. So running to the urgent care is usually futile. We have things backwards, and I'm going to use this lady's story as well, how 5 years can go by from the age of 29 through 34 and be suffering with something so chronic like trigeminal neuralgia, which is clear. You go through the MRIs, you go through the pathology, everything's clear. The head is clear, the brain is clear, the neck is clear, everything's clear. So getting all these clear, healthy results, which you'd think you'd be happy about, but when you're in pain, you're kind of upset. You're like, what is going on? But if you understood, and we understood where pain can start from, I think we would all start at the chiropractor. You really would. And we should. It would save our healthcare system billions of dollars if people would just go there first. So I'm kind of screaming, using my podcast as a voice, because we truly understand pain. We see it every single day, and we see non-visceral pain. People are usually right. And we know when to call an ambulance in case we think it's a heart or a kidney, or when to send you straight to the ER and get, imaging for your kidneys. I've seen kidney stone pain. I've seen possible stroke, pain in the neck where people are coming in, they're holding their neck weird, and it just started abruptly. I'm like, listen, let's go get you checked out at the hospital right now. I just want to make sure it's not something crazy. And I'll tell them, you might be having a stroke. And once they hear that, they're like, oh gosh, and they go and they respect it. And only once have I ever had a patient not call me for a couple of days, and I check in, and the spouse picks up, and they're like, Doc, you were right. They were having a stroke, so they got that all mitigated. They're doing okay. I'm like, wow. So those things they teach you in medical school are absolutely right. So, but remember, that's what medicine does. It goes from pathology first. So you come in with severe pain, they take you seriously. It's not that they want you out with medicines and see you later. They're going to screen you for possible life-threatening conditions, which is good. I mean, we don't want to be ignorant to something and then end up with something serious. So that's the system there. Chiropractors do not. They'll screen you first. That's why we do an exam. So when people come in and say, I got back pain, I don't need an exam. I just need to get cracked, doc. I'm like, nah, we're doing an exam every single time. We cannot treat you without an exam. I mean, that's like calling a carpenter and say, come on in and fix my kitchen without ever them looking at your kitchen. How are they going to design your new cabinets? So that's same with us. We need to look at what's going on before we help you out. Pain, understanding it. If you understand that it's, throbbing, swelling, and it's muscular, start with some ice heat rotation and see what happens in the area to decrease inflammation. That's the most accessible things you have in the moment. And people either default to ice right away and over ice the area and don't give it a chance to decrease the inflammation. So when you put ice on any area, depending on where, let's say it's a low back, 20 minutes max on top of a t-shirt, not directly to the skin. You're going to burn the skin if you have direct cold to the skin for too long. So use a t-shirt or something cotton in between, or a towel, and apply that for up to 20 minutes, and then take a break for 20 to 40 minutes before you do it again, and then rotate. I like the cold heat cycle because what you do is you push the cold on it, which feels good. People get a little bit of relief when they get the cold on there. Then they give it a break, and then they use heat, and the heat will bring blood back to the area. If you get an increased sensation of pain with the heat, you're like, no, cold is better, you have a muscle issue. No reason to run to the ER, no reason to run to, urgent care. Just you stay home. When it comes to these type of episodes, the literature shows three things. You have three options when you have, let's say, low back pain like that, severe low back pain. You can do nothing, and in 2 weeks you'll get better. The pain should go away within 2 weeks. You can go to a chiropractor, or you can go to a physical therapist. They say these are your three options, the best options that have really no change, because in 2 weeks, no matter what you choose, you're going to get better. And the literature keeps showing that, because when chiropractors do it and they do a few treatments for 2 weeks, within 2 weeks, the patients get better. When a physical therapist does their stuff with ultrasound and therapy, in 2 weeks, the patients get better. And if patients do nothing and just rest on the couch for 2 weeks, they do better. So what does that mean? Don't do anything, just sit on the couch for 2 weeks? The point of the story is, and the point of the literature is, that you can just take time off and do nothing and sit on the couch. Now, for many of you, you get 2 weeks off a year for vacation. It's up to you if you want to use those 2 weeks to lay on the couch in pain, waiting for it to subside. The other option is to do therapy. The point of the study is that the people who did therapy were starting to get relief faster within the first couple treatments than the people who rested for 2 weeks. But the point is that in 2 weeks, the body will heal whatever that injury is, and that's muscle and soft tissue. A pinched nerve or nerve pain is relentless. It will not resolve itself. Something is up. Something is being compressed. Something has been injured. And to injure a nerve, it requires blunt traumatic force. You have to hit the nerve some way hard. Usually it's an impact, a slip and fall, a car accident, like through whiplash, where you stretch the nerves of the neck, or a cut, a direct trauma to an arm, and you cut a nerve, or you hit a nerve, or it bled, or whatever that may be. So nerves are relentless. Nerve pain does not go away. So if you're dealing with something for more than 3 weeks, you may actually have nerve pain. Burning, itching, all the other symptoms that come with pain. You can have like a deep burn. That's just depending on where the nerve is being impinged and where it's referring to, and which nerve is being interfered with. The sciatic nerve is made up of 5 big, thick nerves from the spine, and it makes up the thickest nerve in the human body. So, but it can be impinged from different areas. Is it L3, L4 that's impinging the sciatic nerve? Is it L5, S1? Is it S1, S2, S3? Is it a sacrum issue? That's where diagnostics go there. And there's no way to take an image to see a pinched nerve. Very rarely do we see any of this pinched theory on any imaging that we have today. So even sending someone out for that, is not to be that. We still send MRIs, and that's where we can stem disc herniation, disc bulges, degenerative disc disease, and disc issues to maybe where the source of the pain may be. But we can't ignore peripheral entrapment, which could be, a muscle on a muscle, and the nerves getting trapped in between because one muscle's tight or not, and another muscle is in spasm, and it's squeezing a nerve between it like a sandwich. That can happen too. You can have double crush, triple crush syndrome, where you have 3 areas along the nerve. Typically what we see is like a neck pinch because of a disc bulge at the IVF, at the intervertebral foramen, right at the neck, and then a pinch in the shoulder as well from a tight trap pinching onto the AC joint or the back of the scapula. It could be there. And then another one, even at the elbow. So then we have this entire arm that's under nerve pain. So there you go. A boring episode about pain, but what to do with it. And really, you should be going to the chiropractors because they're going to assess this properly, and they're going to have the fastest results. And they're going to refer you, if it's something that's not musculoskeletal, immediately. It's going to be the best primary care for this. And that's why we are the musculoskeletal experts. PT plays a huge role in this as well. Once the diagnosis is certain from either imaging or orthopedic testing, and we know what muscles have been impacted, they're eventually going to need to be strengthened and rehabbed. That's where PT comes into the, and some chiros have PT in office too. Some of these clinics are multidisciplinary. So look into your local ones, look into your Facebook groups, your social media groups, ask people who've had success in the group. You maybe don't spill your guts about all the symptoms that you have, but say, hey, I'm having some trouble with pain. Who do you recommend? And you're going to get a whole bunch of stuff. You're going to get PT, chiropractic, orthopedic. Typically, those are the top 3 referrals. But what are you going to get if you go to an orthopedic? Any rehab, any adjustments? No, you're going to get medicine and injection, which maybe your pain is so bad and you need it, but even the injections fail. So that is just to save you time. That's the whole point of this podcast, is to save you time, enlighten you with knowledge so that you can make decisions for you and your family quickly, effectively, and have resources available to you that are there. What do chiropractors do? They assess the central nervous system to make sure it is functioning at its best. That's what we do. Clear brain stem, clear spinal cord, so that those nerves can talk and refer back and forth to the body at an optimal function. That is it, period. That's what chiropractors do. Because of that, they also deal with the pain that comes with if that's not working optimally. So then the assessment plays a perfect role into helping people with nerve pain. That's what we do. What does a physical therapist do? Assesses the physical assessment or the physical functionality of the movement of the body. Every single joint in the body, they can assess and move. That is great. If you have a mobility issue, physical therapy, they're going to be the quicker ones to have modalities at the office immediately to help you with all types of those. And then there's specialties too. We all have our specialties as well. So the difference when people are like, well, should I go to PT or should I go to chiropractic? And when you're in extreme pain, are you going to go to PT who's going to try and move you around and make you do burpees? I'm joking. They're not going to make you do burpees. But when you're in pain, are you going to go to someone who's going to lie you down on a comfortable table and assess the issue and do something that you don't have to move, you don't have to do anything? They may even have, in our office, we got spinal decompression, we got traction, we got flexion distraction, we've got vibration therapy, we got laser therapy, we got, all the inflammation stuff to help people with not only pain, but general wellness as well. So, but you'll have acupuncture, we got all the tools to do that. So I highly encourage you to implore chiropractic first. Chiropractic still is at about a 10% utilization rate in America, which means 10% of Americans utilize chiropractic. It's crazy. It means that the point of that is it means that everyone else is going to urgent care. And we get the results. If you keep doing the same thing over and over again with the same results and you're disappointed with the results, pretty sure someone in history said that's the definition of stupidity, right? Or insanity, whatever that may be. I hope that helps. If you're in pain, this podcast was probably painful because you're just listening to the definition of why you're in pain. But that story really motivated me to just get on here and do a podcast about, don't have to suffer for 5 weeks, 5 months, 5 years with pain. If you find the right people, make sure chiropractic is in your top 3 that you check. And don't give up. And just because, one thing didn't work doesn't mean another thing won't. Take care of yourselves, stay healthy, stay well, have a wonderful week. We'll catch you next time.
Thanks so much for tuning into this episode of Living a Full Life podcast. If you're enjoying the show, please feel free to rate, subscribe, and leave a review wherever you listen to your podcasts. That helps others find the show, and we greatly appreciate it. Thanks again for tuning in, and we'll catch you in the next episode.